Heartburn, I think, is just kind of an early stage where you just get a little bit of irritation after you eat something wrong, eat something too spicy, drink too much coffee, or some people get it after they drink some alcohol because it loosens or relaxes the valve down at the bottom of the esophagus. But anytime you start having things coming up more consistently, they're burning every day or several times a week, then that's pretty severe, and I'd categorize that as having GERD. Gastroesophageal reflux disease.
Symptoms include persistent heartburn, regurgitation, serious cough, even trouble sleeping or eating.
Long-term damage to the esophagus with acid and stomach juices can lead to something called Barrett's esophagus. And Barrett's esophagus is actually a precancerous state. If that doesn't get taken care of and managed, that can definitely lead to cancer. If you have enough reflux issues and you take some over-the-counter medications, which there are a variety of these days, and that's not enough to help you, you definitely need to come seek some medical advice.
Doctors at Texas Laparoscopic Consultants say oftentimes people just blame these symptoms on something they ate or drank and put off getting treatment, which can eventually lead to more serious illnesses.
We sit down and we talk to the person and figure out how bad their symptoms are and what kind of medicines they're having to take and what their goals and expectations are. And then we send them for testing of their esophagus to see how much acid they have in their esophagus, see how well their esophagus works.
Texas Laparoscopic Consultants care about the overall well-being of patients, and that's why they offer a variety of comprehensive surgeries and procedures for a number of different debilitating conditions, including GERD. They have 3 main procedures to help patients get relief.
One is a procedure called TIF. It's basically a device we put down through the mouth where we can actually go in and tighten the valve at the bottom of the esophagus with no incision. So it's almost an incisionless surgery. And what we try to do is mimic a procedure called the fundoplication, which is the gold standard for surgeries that we do. That's a laparoscopic surgery where actually we go in and we wrap the stomach around the lower esophagus, and that helps to reinforce that lower sphincter. Because the main problem when people have GERD is that lower sphincter is just not hardy enough to help keep acid and stomach contents down in the stomach. And the third and the newest procedure that we're offering here now is a procedure called LINX. And what that is a ring of magnetic beads that we place on the lower esophageal sphincter, and that acts to reinforce your sphincter to keep things strong.
They stay together until you put enough force on them and they come apart and allow you to burp, or when you eat, the food goes through and then they spread apart and then they close back together to allow people to eat normally. So that's basically it. It's a very simple procedure.
And with many of these procedures, patients can go home the same day and return to work a few days later.
The results people see is anywhere from 90 to 95% of patients or more see very immediate relief. Patients who've been taking reflux medications for most of their adult life, the first time they wake up after surgery or after a procedure, they notice they don't have reflux, then they didn't need to take their medications. And so that's something pretty exciting for us, is seeing the immediate gratification that people get after these procedures.
Since GERD is a medical condition, it is covered by most insurance companies. Check out Texas Laparoscopic Consultants online at tlcsurgery.com to learn more about GERD and to schedule your appointment.